Thank you very much. Assalamu alaikum. It's a great pleasure for me to be here with you, and deepest thanks to Pakistan Society of Nuclear Medicine, and particularly to Professor Shazia Fatima. As you know, nuclear medicine is based on quality management. Quality management is the backbone of nuclear medicine. We need qualified human resources, nuclear medicine physicians, technologists, nurses, radiopharmacists, and radiophysicists or medical physicists. Radiopharmacy is the backbone of nuclear medicine too, and quality control is the backbone. And equipment, we must have quality control of equipment since the hot lab, dose calibrator, and hybrid imaging. State-of-the-art nuclear medicine is currently based on Theranostic. It consists in using the same molecule for diagnosis and therapy. Finally, artificial intelligence is also emerging in nuclear medicine and promising development to use functional imaging as a biomarker. The future in nuclear medicine, you explain, you have a relevant presentation in this field, hybrid imaging and Theranostic. Hybrid imaging, PET-CT, SPECT-CT, and PET-MRI, they boosted research and development in many areas of interest, such as oncology, cardiology, neurology, and orthopedic surgery. Nuclear medicine creates images using internal radiation wave from inside the body, and it's functional imaging versus anatomical imaging in radiology. The role of PET-CT is now really established, and the new in hybrid imaging is the CZT camera, cadmium zinc tellure camera. This new technology may change current practice, such as decreasing acquisition time and activity injected to the patient. The future in hybrid imaging, SPECT-CT will continue to evolve, and whole-body SPECT-CT will be common practice with absolute quantification of tracer concentration, and the gap between PET and conventional nuclear medicine will be reduced. PET domain will advance mainly due to the shift to digital detectors and the incorporation of whole-body PET camera and artificial intelligence. The field of Theranostic will continue to advance with new indication and specific tracer, increasing the impact of our specialty on patient care. I just brief Theranostic. Since 2000, the number of nuclear medicine procedures increased considerably, and according to the World Nuclear Association, more than 40 million nuclear medicine procedures are performed each year worldwide, with 20 million nuclear medicine procedures performed annually in the United States. Thanks to progress in radiopharmaceutical, the demand of radiopharmaceutical is increasing up to 5% annually. Nuclear medicine has become the essential tool and the cornerstone in several specialties, particularly in cardiology and oncology. Precision medicine weapon against cancer represents not only one of the priority areas of research, but also an immense hope for patients in the fight against this disease. And like we see in the last presentation, one stone can kill 2 or 3 birds. We can see what you treat and treat what you see, as this picture from Richard Baum Medical Clinic. The personalized cancer therapy is an old concept since 1999 by Paul Ehrlich. And the father of nuclear medicine and of radioiodine therapy is Professor Sol Herz, and I met a great pleasure to see her daughter in this congress and this audience. The first application of Theranostic for molecular targeted radiotherapy in history, and the cornerstone of nuclear medicine therapy since 1941. a practice changing paradigm, effective, affordable, and practicable. The history of Theranostic, the commonly used theranostic agent therapy, actinium, bismuth, but also lead and terbium. Thyroid cancer, the incidence is increasing in Morocco too, and we can see you the role of SPECT-CT to localize the metastatic disease. Gallium, lutetium, gallium dotatate, and lutetium octreotate in net neuroendocrine cancer. In our department, we have only technetium octreotide to visualize net disease, and obviously calcium dotatate and lutetium dotatate were approved by FDA since 2018. For prostate cancer, lutetium PSMA was approved in March 2022. The difference between chemotherapy or immunotherapy and radionuclide targeted therapy is the difference between forest fire and lighting. The success of personalized medicine is very important and relevant because it allows us to have prediction, selection, targeting, and prevention. In developing country, should technetium PSMA replace gallium PSMA, or for few countries in Africa, fluor-18 PSMA versus calcium PSMA. In treatment, iodine-131 PSMA versus lutetium PSMA. In low-income country, the four major non-communicable diseases are cardiovascular disease, cancer, chronic respiratory disease, and diabetes. Every year, 8 million victims in the world globally, an estimated of approximately 20 million people worldwide who are newly diagnosed with cancer in 2020, and 9.9 million died due to cancer. In the next 20 years, a surprise of up to 30.2 million new cases and 16.3 million cancer deaths is estimated globally. Non-communicable diseases in low and middle country are responsible of premature death. Each year, 15 million people die from NCD between the ages of 30 and 69 years. Cardiovascular diseases are responsible for approximately 80 million people annually, followed by cancer with 9 million. The number of cancer cases doubled between 20 and 22 and almost tripled by 2030. So it's urgent to establish a comprehensive and integrated strategy. It requires a general mobilization to fight against cancer. And the most common cancer diagnosed in men and women in 2023, prostate, lung, and bronchus and colon cancer in men account for almost 1/2 of all incident cases in men, with prostate cancer alone accounting for approximately 30% of diagnosis. In women who have breast, lung cancer, and colorectal cancer account for 52% of all new diagnoses, with breast cancer alone accounting for 31% of female cancers. In low-income and middle-income countries, according to the International Agency for Research on Cancer, about 70% of cancer deaths occur in low-income and middle-income countries. Good quality data for cancer incidence and survival are often unavailable in Africa, in some countries in Asia, and Latin America. Cancer registries are crucial for the assessment of national control program and other preventive and treatment efforts. What about African situation? The population of Africa is actually 1.3 billion. It will become in 2052 to 3 billion, and in 2100, 4.4 billion. We have strong disparity between developed and developing countries. The area of Africa is bigger than all of Europe, China, and the United States of America combined. The African population is about 1.3 billion and would be 2 to 3 billion inhabitants in 2050. It would involve political, cultural, and ecological tomorrow upsides. In 2023, only 29 African countries have access to nuclear medicine. Many countries with nuclear medicine service are still not capable of performing some very important studies. Now with that, oncological or radiation therapy cannot be established without nuclear medicine imaging and therapy. And when I met the director of the IEA 1 year ago, I tell him, rise of hope, it's not only radiation therapy, it's radiation therapy without nuclear medicine, without pathologists, without imaging, is not a good radiotherapy. There is an urgent knowing that oncological or radiation therapy cannot be established without nuclear medicine imaging and therapy. There is an urgent need to reduce the existing disparity to establish a relevant strategy.
Professor Nozha, last 4 minutes.
Nuclear medicine facility in Africa. In all Africa, we have 55 countries. 29 countries was at least one nuclear medicine unit, and one country has only a radioimmunoassay unit. Among 28 countries, 16 have a unique department for all the whole country, and 13 have at least 2 nuclear medicine departments. Highest density of nuclear medicine department is in North Africa and South Africa. According to the data provided by the IEA, this translates into 0.24 SPECT scanner per million inhabitants. 85% of total SPECTs available in the continent reside in 5 particular upper middle income: South Africa, North Africa, represented by Egypt, Morocco, Algeria, and Tunisia. Cyclotron and PET imaging. These facilities have contributed to the rapid local development of PET CT in Egypt, South Africa, and Morocco. Priority for establishment and sustainability of nuclear medicine in Africa: human resources, equipment, radiopharmaceutical, and awareness. Human resources and education. Nuclear medicine physician, 5 countries, the same, Algeria, Morocco, Egypt, South Africa, and Tunisia, have an independent specialty and have been offering both undergraduate and postgraduate training for nuclear medicine physician for the past 2 to 3 decades. Training consists of a 4-year program. Radiopharmacy and or radiochemie in South Africa, and more recently in Morocco and Egypt. Medical physics too. We are very involved in South-South cooperation since 2020. Africa's need. With the exponential growth of nuclear medicine in the world over the last 2 decades, we have lack of quality human resources and relevant equipment, lack of a domestic production of radiopharmaceuticals. The pandemic has made us aware of the need of local production and the lack of maintenance and quality management in nuclear medicine. And nuclear medicine is very expensive too. We haven't insurance in all the countries, practically. Africa is the future. because Africa is the bigger continent with a bigger population. We need to continue to develop South-South cooperation, and it's the role of association, nuclear association, WHO and IAEA. IAEA played an important role by technical cooperation, but regional project, by AFRA training course or workshop, and also CRP. Nuclear medicine in Morocco. I am the founder of nuclear medicine in Morocco. Morocco is the first country in Maghreb and North Africa with nuclear medicine as an independent degree specialty since 20 years. The first country in Maghreb to have PET-CT since 30 years, with currently 2 private cyclotrons. The first country in Maghreb to produce fluorine 18 FDG since 40 years ago, followed by 18 fluorocholine and recently 18 fluor PSMA. In Morocco, we have 20 PET-CT with 2 digital PET, 2 first in North Africa and 3 in progress. PET in Morocco, in different centers. I am also a leader of WINME, Women in Nuclear Medicine, with group expert of WIN Global, and I help to achieve gender parity in nuclear medicine with the global community of practice, and we develop concrete measures to attract more medical students and doctors, particularly young female students, to pursue a career in nuclear medicine, and to enhance awareness and visibility of the role of nuclear medicine to support the creation and expansion of nuclear medicine service, especially in developing countries. I am very involved in parity and actively campaign and fight against gender disparity, fight against brain drain. Till 2003, Ibn Sina was the only nuclear medicine department in Morocco, and now we are 27 departments. Of the 75 nuclear medicine specialists, more than 2/3 are women. Men are mostly in private sectors, while university centers are practically all headed by women. All residents in progress training in the country are mostly women. Conclusion, we need qualified human rules. We continue educational training by AFRA training, IAEA platform, EINM, SFMN, SNME. Train the trainers, keep young nuclear medicine specialists in the university sector. Local, we try to have local production. We have just production for positron emitter. Nuclear medicine must continue to shine in a peaceful world.
Dr. Nozha, can we just...
Thank you.